Republicans and even some Democrats have asked how this could be implemented and how we would pay for it. Republicans have brought up common issues in other countries with similar healthcare systems, especially wait times and procedure rationing. They'll also point to the issues with the Veterans Affairs hospitals to show how bad U.S. government-run healthcare could be. Starting with implementation, Elizabeth Warren has said the way she would implement Medicare for All would be to start by bringing down the cost of drugs and insurance costs through executive order, pass legislation in the short term that will allow anybody to opt into Medicare, and then pass Medicare for All as a long-term plan. Bernie Sanders has said he'd just go whole hog, passing mandatory Medicare for All in its entirety as soon as possible. The concern with this is you're eliminating the entire health insurance industry, so there's tons of overnight job loss there. On costs, Sanders has put forward a few ideas for ways to pay for Medicare for All. The largest chunks under Sanders' plan are coming from taxing employers, a 4% income tax on most people, and eliminating the tax deduction for employer-paid premiums because those will go away altogether anyways. Warren's plan is to get the money with a larger tax on employers, essentially matching what employers pay today towards employee health insurance, and a 6% wealth tax on net worth over $1 billion. I do want to quickly talk about a wealth tax because it's gotten lots of attention as a silver bullet to help pay for Medicare for All instead of having to increase taxes. 20 years ago, 12 major countries had wealth taxes, of which 9 got rid of them as of today because they were tough to enforce, rich people fled the country, and they didn't bring in enough money to justify the headache. So for a country like the US with lots of rich people and a lack of political will to expand the IRS, I think it's clear a wealth tax is politically appealing, but totally unrealistic when you start thinking about the specifics of how it would work. That being said, I think the cost question gets too much attention just overall. Democrats are lying when they say they wouldn't raise taxes to pay for this, but Republicans are disingenuous to treat this as an added expense too. Today, health insurance is mainly paid for by employee and employer premiums. Most likely, employees and employers would end up paying through taxes instead. Let's look at the validity of the argument that Medicare for All will lead to longer wait times and healthcare rationing. In general, what the numbers tell us is that the US is one of the best countries in terms of wait times, but not that much better than countries with universal health coverage and a mixed public-private system. Single-payer systems in general lag the mixed public-private systems in wait times, but again, the differences are relatively minor. There are definitely outliers in certain areas, which both sides like to cherry-pick to either make the US look awful or show how bad single-payer systems are, so you should be skeptical of specific country-to-country comparisons in general. On rationing, most countries do ration healthcare by putting off elective surgeries or limiting access to the newest drugs when older, cheaper drugs are available. Democrats argue the US healthcare system is self-rationing, though, in the sense that people skip or put off medical care because of cost. So to that point, we saw longer wait times in the US a few years ago as a result of passage of the Affordable Care Act and a better economy. Now let's talk about VA hospitals. To some extent, we're talking apples to oranges here. The government not only insures the veterans, but also runs the hospitals and employs the doctors, which is not what's been proposed in the US by Bernie Sanders or anybody else. That's more on par with the socialized healthcare systems that they have in the UK. The public option is considered the more moderate Democrat approach to healthcare. In general, what that means is that people could buy into Medicare to compete alongside private insurance. The idea being that Medicare could force down the cost of private insurance through competition. This differs from Medicare for All in a couple key ways. For starters, the implementation piece is a lot simpler. It integrates within the existing system with private insurance still in place. That means existing jobs in the insurance industry are protected, and the possibility for the free market to effectively allocate resources or innovate are left intact to some extent still. But that's a double-edged sword. That also means those admin costs are left intact too. And if a public option doesn't effectively change insurance company incentives the way that we'd hope, you have the same bad incentives running rampant. And that's on top of the risk that lobbies and special interests are able to raise Medicare reimbursement to private insurance levels instead of the opposite. That means it's even more important that the system is constructed thoughtfully. The Republican healthcare solution has been to repeal the Affordable Care Act. Their own replacement idea is to allow health insurance portability, provide funding for states to set up high-risk pools, expand HSAs or health savings accounts, and replace Medicaid with per capita state grants. As far as Obamacare goes, there are tons of claims made by Republicans. It didn't make healthcare more affordable, reduced quality of care, limits innovation, increased hospital market concentration, reduced jobs, longer wait times, worse health outcomes, and many, many more. So some of these are fact-based and some are not. So I'll tell you what we do know based on studies that have come out. Based on research, in the short term, the uninsured rate fell and socioeconomic disparities in health coverage fell. But on the downside, wait times increased, care did not improve, healthcare costs did not decrease, it just shifted expenses from out of pocket to increased premiums because of the new minimum coverage requirements. Ultimately, this ended up being a trade-off between getting more people insured on one hand and cost and wait time increases on the other. It didn't live up to the lofty statements that Democrats made about it fixing our healthcare system, but at worst it was a trade-off in which people who made under 400% of the poverty limit were helped in the form of subsidized insurance, and people who made over that were hurt in the form of higher premiums. To help people who would lose health coverage by an Obamacare repeal, specifically with pre-existing conditions, Republicans propose health insurance portability and funding to states to set up high-risk pools. Health insurance portability means that if somebody is insured, they must be allowed to switch plans if they want, regardless of any pre-existing conditions. A law like this already exists for employer health plans, so it does make sense for the individual market too. It would definitely help some people, but doesn't do anything for the large group of people who aren't insured to begin with, whether or not they can afford it. The other mechanism, funding for high-risk pools, is a solution to the death spiral. With high-risk pools, the federal government would give states money to insure people rejected by insurance companies because of pre-existing conditions. High-risk pools have been tried in a number of states, and the results are mixed and come down to adequate funding. People rejected by insurance companies are rejected for a reason. They're incredibly expensive to insure, and because of that, many states have underfunded high-risk pools, so you end up with a wait list or unaffordable plans. In the states with adequate funding, it did work really well though, of course at a very, very steep price. Health insurance portability and high-risk pools are legitimate tools to get people in individual markets insured, but keep in mind they don't directly offer any solution for people who are healthy but just poor. Republicans also want to expand HSAs or health savings accounts. These are tax-deductible investment accounts like a retirement account, but can only be used for healthcare expenses. HSAs are only allowed with insurance policies that have high deductibles, so the idea is that people will seek out lower prices or be more prudent in seeking medical care if they're spending their own money versus spending the insurance company's money. Specifically, Republicans want to allow HSAs to pay premiums, allow their use even without a high-deductible health plan, and increase contributions limits to HSAs. Studies show a slightly lower discretionary spending on expenses like pharmaceuticals and doctor visits when it comes to HSAs, but not on higher dollar spending. No studies are able to say whether this is the result of self-selection or changing behaviors, though. From a conceptual standpoint, though, decoupling HSAs from high-deductible health plans seems counterintuitive if you want people to bear the financial burden of their medical choices. The final Republican solution is replacing Medicaid with per capita grants. So instead of the federal government paying a percent of state Medicaid expenses, typically half, it just sends a set amount of money to each state to spend however the state thinks is best. The argument goes that you give states money, and they can use that money to be more efficient and innovative than the federal government could be. Also, the federal government wouldn't be on the hook for ever increasing healthcare costs. Democrats say it's just an attempt to spend less and will only lead to less money for Medicaid programs overall. There's probably truth in both sides. States could come up with solutions that are tailored specifically to their state populations, but there's really no evidence that savings would come out of all of that. That's it for the talking points and proposed solutions on both sides, but I do want to say that healthcare is extremely complicated, and because of that, there's so much room for innovative solutions. The problem is that we live in an age where it's about quick sound bites for politicians and the media, and because of that, I think our options for solving this are really disappointing. It'll take a bold, creative, intelligent leader to give us the solutions that we need on healthcare, and unfortunately, I'm not sure we have any of those among our politicians on either side. Thanks for watching. Hey, if you found this video interesting or useful, please give it a thumbs up, put a comment below, and subscribe to my channel to get any updates on new videos. If you didn't like it, you should probably go ahead and put a comment below too to let everybody know. Either way, thanks for watching.